We have discussed how waveforms and measurements are affected by settings of different components on the electromyograph. They are also affected by the technique and use of instrument controls made by the operator. Deviation from the standard testing protocols can lead to pitfalls in electrodiagnostic studies. The most common error in nerve conduction studies arises from lack of temperature control. The recommended temperature is 32 degrees centigrade or higher for upper limb studies and 29 degrees centigrade or higher for the lower limb studies. At lower temperature, the latency of the response is increased and the nerve conduction velocity is reduced. This pattern of findings is associated with demyelination. Here is an antidromically recorded median sensory nerve action potential from a healthy subject when the temperature was 32 degrees centigrade and 27 degrees centigrade. The change in waveform is better appreciated from the superimposed traces. Let's examine the measurements at the two temperature settings. The conduction velocity was lower and the peak latency was higher at the low temperature. Here are the compound muscle action potential recordings in a median motor nerve conduction study when the temperature was 32 degrees centigrade and 27 degrees centigrade. The change in waveform is better appreciated from the superimposed traces. The tabulated data shows increased distal latency at lower temperature. Fortunately, the temperature artifact can be recognized quite easily. At lower temperature, the waveform duration is increased. It looks very broad. The very high normal amplitude is also inconsistent with an abnormal sensory nerve. The temperature can be measured using a thermistor built within the instrument or using external device such as an infrared probe. My preference is to use an external device as it gives results instantaneously and it is far less cumbersome to use. It does not involve taping thermistor, associated wires, etc. When the patient is cold, there are two options. The first one is to warm the tested limb. This is done in a variety of ways. Some laboratories have custom sinks that can be filled with hot water to warm hands and feet. Other laboratories use heating pads used in physical therapy. Hair dryer and heating lamps, etc. have also been used. It is important to allow sufficient time for the heat to spread to the deeper tissue that surrounds the nerve. Note that we measure the skin temperature that will rise as soon as we apply the heating device. We need the core temperature to increase before testing. We should monitor the patient when the heating device is applied to avoid burns and injuries. The second approach is to use temperature corrections. Here is an example. Corrected velocity is equal to measured velocity plus 2 times the difference between 32 degrees centigrade and patient temperature. The correction factor in this example is 2 meters per second per degree centigrade. The desired temperature for velocity measurements is 32 degrees centigrade. If the patient temperature is 30 degrees, the correction will be 4 meters per second. If the velocity measured at 30 degrees centigrade is 48 meters per second, then the corrected velocity at 32 degrees centigrade will be 52 meters per second. This is not my preference for 2 reasons. The correction factor varies among different individuals. Secondly, the factors are based on healthy nerves and may not be suitable for nerves affected by disease. In sensory nerve conduction studies, the operator places the E1 and E2 electrodes and adjusts the distance between them. Here is an example of sensory nerve conduction study when the distance between E1 and E2 electrodes was increased from 7 to 47 millimeters. 7 millimeter, 15 millimeters, 30 millimeters, 40 millimeters, and 47 millimeters. The numerical data is tabulated. Note the reduced amplitude at shorter distance, but the latency is unaffected. This pattern is similar to axonal neuropathy. Hence, short distance between E1 and E2 electrodes should be avoided. The recommended distance between the E1 and E2 electrodes is 4 centimeters. This is obtained from the following arguments. Consider a nerve segment with E1 and E2 electrodes over it. The distance between them is 4 centimeters. The nerve action potential is propagating from right to left at a speed of 50 meters per second. The rise time of the potential is 0.8 milliseconds. When the action potential arrives at the E1 electrode, both electrodes are at zero voltage. As the potential propagates, the voltage under E1 increases while the E2 is still recording a zero voltage. At time 0.8 milliseconds, the voltage will have peaked under the E1 electrode. The potential has just reached the E2 electrode and the voltage is still zero. The amplifier measures the voltage difference between E1 and E2 electrodes, and in this recording the maximal voltage of the response is recorded. If the distance is reduced, the potential reaches E2 electrode earlier. When the E1 electrode is recording the maximum voltage, the E2 is also recording a non-zero voltage. The differential amplifier will subtract these voltages and give a smaller response. The choice of 4 centimeter distance between E1 and E2 electrodes is based on the rise time of the sensory nerve action potential and its propagation velocity in a healthy nerve. It is acceptable to use shorter distance so long as one uses it in a consistent manner and has appropriate reference values for amplitude. The position of E2 electrode is also critical in motor nerve conduction studies. We recorded the compound muscle action potential using 3 different positions of the E2 electrode: over the muscle, at the tendon, and distal to the thumb. The position of the E1 electrode was identical and it was over the motor point. When the E2 electrode is over the muscle, the CMAP amplitude is lowest due to cancellation of signals recorded by the E1 and E2 electrodes. When the E2 is over the tendon, the amplitude was highest. At a further distal position of E2, the amplitude was intermediate. Also note the change in the CMAP duration and the waveform. To allow comparison of studies, one must standardize the E2 electrode position. The electromyograph makes the latency and amplitude assessments automatically. It is up to the user to make sure the automated measurements are correct. The peak detection is usually not a major problem. However, the onset latency measurement in a motor nerve conduction study can be confusing. Here are 2 CMAP waveforms with manual marking of the onset as indicated by marker 1. Note the difference in the associated latencies. The problem is that both traces are the same waveform but shown at different gain settings. The visual assessment of CMAP onset depends on the display gain. The automated measurements are based on slope and amplitude criteria that are applied in a consistent manner, and they may be independent of the display gain. Hence, I rely on automated measurements as far as possible. When I'm not sure, I display the signals using a standard display gain setting. I use 1 millivolt per division. You can use whatever setting you like. If the marker position looks wrong, I make the corrections at that setting. That brings us to the next pitfall in marking the onset of a response. As discussed in volume conduction section, the onset of the Cmap should always be measured from the first deviation from the baseline, regardless of whether it is initially going down or going up. The onset should be checked using a standard display gain as we just discussed. In sensory nerve conduction studies, some responses have an initial negative deflection. The onset is measured from the baseline as the signal voltage increases. In other recordings, the potential has an initial positive dip. In these recordings, the onset marker is placed at the peak of this positive deflection. This is different from motor nerve conduction study. These rules are based on the principles of volume conduction and generation of the action potential waveform, and these rules should be followed properly for making measurements and interpretations of the signals.